Mental health has long been viewed differently than physical health, often surrounded by stigma, misunderstanding, or silence. Yet mental wellness exists on a spectrum that every person moves along at different stages of life. From everyday stress to more serious challenges, everyone benefits from support.
You wonder why is it that some individuals wait till they've hit their breaking point to seek out care. Issues these days are insurance coverage and having the resources and also having the insight to know that you need treatment. There's still stigma out there, but yet most of the people who are viewing these illnesses through the stigma lens are themselves struggling or have somebody in their family that is struggling with a mental illness or a substance use disorder.
I think in crisis services, most often we're seeing people that are not well resourced. And I think that looks a lot of different ways for everybody, whether that's the social cues they saw growing up or the professional supports they have or don't have. I think people wait so long to receive services because they're afraid. Society, social media, and everything tells us that we need to be strong and we need to handle things in a certain way. And it's just easier to tuck it away until it's too big to tuck away. There's that little piece of us that just tells us it can't be me. That reaching out for help is admitting something that tells the world that we have a flaw.
Mental health care can often feel fragmented, but Brightwater Health in Duluth, Minnesota is working to change that. Brightwater provides wraparound support for individuals and families at every stage of need. Their mission is to make mental health care accessible, compassionate, and easier to navigate.
Brightwater's mission in supporting overall wellness in the community is to make mental health and behavioral health care affordable and accessible to everybody. Getting help is overwhelming in itself for people, so the help itself should not be another reason of stress. The integrated model here helps reduce barriers for people getting care by taking the overall burden off of the families. When our teams work together with our providers, it allows people to get that comprehensive wraparound care so people don't have to tell their stories over and over again and they can just focus on getting the help that they need. If care isn't affordable, it's not accessible. Affordability should never be the reason that prevents somebody from getting help. The accessibility allows people to get help before things become unmanageable.
If you're able to receive all the services that you need under the same roof, the communication is better, and that really makes a huge difference. For example, myself as a psychiatric provider, if I see somebody every 3 months, but in between they're meeting with these other providers, a lot more information when they come in for my visit that I'm able to work off of, that I have easy, ready access.
For a lot of the folks we serve, that teenage part of life becomes difficult and you feel a little lost, and that was definitely the case for me. Not knowing who I was or who I wanted to be turned into eventually some substance use. When I entered treatment at Brightwater, I had no idea what to expect. What stood out the most is that I felt like it didn't matter what we were talking about as much as it mattered that I felt like I had a place to go, that the people there cared. After some time, I was offered a job as a peer recovery specialist at Brightwater Health. I think the most rewarding part of the job for me is the normalizing. There are so many little things that we think are individual to us, and when you see that people as a whole experience anxiety and low mood and substance use, a lot of the time it helps you know that you're not alone.
Nobody is immune to challenges. We are all human, and being able to get that early intervention ensures that people are able to build up that resilience to go through those difficult moments. When funding gets unstable, people still need the support, and without the funding, programs shrink, wait lists grow. Brightwater Health is doing everything that we can to be creative with the resources and the systems that we do have in order to deal with the obstacles that come with life. The more people that are able to use different skills and have that support, then they're able to support other people. And it creates a ripple effect in the community. People are supporting one another. We're all in this together, and that nobody is alone in whatever challenges that they're facing.
As demand for mental health care continues to grow, Brightwater Health remains focused on expanding services while protecting access for the communities they serve. Their mission is simple. Mental health care is for everyone, at every stage of life. To request an appointment and begin your comprehensive journey, visit brightwaterhealth.org.